For histology spotters, you have to know 3 to 4 key points to each slide. Now coming to general tissues, for hyaline cartilage, the points are it is bluish white ground glass matrix. Chondrocytes are present in lacuna, often in groups, that is isogenous groups, and perichondrium is at the periphery. It is found in tracheal ring, articular cartilage, and costal cartilage. Then elastic cartilage, the matrix packed with branching elastic fibers. Then chondrocytes are larger, more numerous than hyaline. Perichondrium is present and it found in pinna and epiglottis. For fibrocartilage, the row of chondrocytes between thick collagen bundles, there is no distant perichondrium. It is very important. For perichondrium is present in hyaline and elastic cartilage, whereas there is no distant perichondrium in fibrocartilage. Fibrocartilage is present in intervertebral disc and pubic symphysis. Coming to cardiac muscle, the points are branching fibers and intercalated disc, central single or double oval nucleus, and faint cross striations. For skeletal muscle, long unbranched parallel fibers, multiple peripheral nuclei, clear cross striations. For bone, concentric lamella around the central Harvasian canal, that is osteon. Lacunae with canaliculae radiating out, and cement lines at the periphery of the osteon. You have to know the lamellae. There is three types of lamellae: circumferential lamellae, interstitial lamellae, and concentric lamellae. Coming to nerve fiber, you have to know there is wavy parallel axons, nodes of Renvie visible as constrictions. Coming to optic nerve, bundles of myelinated nerve fibers, and there is no nerve cell bodies, and it is surrounded by meninges, dura, arachnoid, pyometer, which is continuous with sclera or choroid. Central retinal artery and vein is seen centrally, and sympathetic ganglion, multipolar neurons scattered irregularly, and satellite cells are around each neuron. No pseudo unipolar shape, and nucleus is often eccentric, whereas spinal ganglion, pseudo unipolar neurons arranged in rows at the periphery, whereas sympathetic, it is multipolar scattered irregularly. For spinal, it is pseudo unipolar neurons arranged in clusters, nerve fiber bundles running through the center, satellite cells around each neuron. Both sympathetic and spinal ganglion have satellite cells. Coming for large artery, you have thick tunica media with multiple elastic lamellae. Internal elastic lamellae is less distant. For vessel, whether it is artery or vein, you have three layers. One is tunica intima, tunica media, and tunica adventitia. For artery, you have thick tunica media, whereas vein, you have thick tunica adventitia. For large vein, the points are you have thin wall, poorly defined three layers, collapsed lumen, and thick adventitia. Whereas for medium sized muscular artery, the prominent internal elastic lamina is the important point, and thick tunica media of smooth muscle, external elastic lamina is also visible. For lymph node, capsule with subcapsular sinus, outer cortex, and inner medulla. Outer cortex has lymphoid follicles with germinal centers, whereas inner medulla has medullary cords and sinus. And you have hilum on one side for lymph node. For tonsil, it is lined by stratified squamous epithelium with deep crypts. Lymphoid follicles with germinal centers are beneath the epithelium. There is no true capsule, only partial capsule. For thymus, the points are lobulated. Each lobule has cortex, that is outer cortex, and inner medulla. Hassel corpuscles in the medulla, that is concentric whorls, is a hallmark feature. There is no germinal centers. For spleen, you have to know red pulp and white pulp. Red pulp are blood-filled sinusoids, whereas white pulp is lymphoid tissue around the central artery. Central artery eccentrically placed in white pulp, that is your key feature, and trabecular carrying the trabecular vessels. For thin skin, you have to know the layers of epidermis. Epidermis have 5 layers. For skin, you have epidermis. Below epidermis you have dermis, and then you have hypodermis. In thin skin, the stratum corneum is thin and you don't have any stratum lucidum. There is absent hair follicles, but thin skin has. To histology of GI tract, you have to know the 4 lining layers. One is mucosa, submucosa, muscularis mucosae, and serosa adventitia. This is the key point for all GI histology slides. Mucosa contains lining epithelium, lamina propria, and muscularis mucosae, and you have submucosa, and muscularis externa is the 3rd layer, which have your smooth muscle layer, and serosa and adventitia is the 4th layer. Coming to esophagus, it is lined by stratified squamous non-keratinized epithelium, which is the key feature, and you have mucous gland in submucosa. And you have thick muscularis from which differentiated in upper, middle and lower third, which is skeletal to smooth transition depending on the level. Coming to stomach, you have 2 slides. You have to know fundus and pylorus. Fundus, the gastric pits with gastric glands you have parietal, which is pink in color, and chief cells, basophilic cells, which is found in fundus, and you don't have any goblet cells, which is the distinguished feature from intestine. For duodenum, the key feature is Brunner's gland in submucosa, and crypts of Liebergens at base of the villi, and goblet cells are present. For jejunum, you have long finger-like villi. There is no Brunner's gland, which is distinguished from duodenum, and no Peyer's patch, which distinguishes it from ileum. For ileum, the key feature is Peyer's patches. What is Peyer's patches? It is lymphoid aggregation in submucosa. That is a key identification feature of ileum. And villi are short and broader than jejunum, and you have more goblet cells. Coming to large intestine, you don't have any villi, flat surface with straight tubular crypts, numerous goblet cells, no Paneth cells. In large intestine, you don't have villi and no Paneth cells. Coming to appendix, small lumen and irregular in shape, but you do have abundant lymphoid follicles extending into submucosa, which is a key feature, and crypts are shorter and fewer than colon. Coming to liver, hepatocytes are arranged in cards radiating from central vein and portal triad at the corners. Portal triad consists of bile duct, hepatic artery and portal vein. Sinusoids between the cards lined by Coffer cells, which is your macrophagic cells. You have to know hepatic lobule, portal lobule and portal acini. Coming to pancreas, it is an exocrine acini forming most of the tissue, and islets of Langerhans, pale staining round cluster cells scattered among the acini. You don't have any striated ducts, which distinguish from the parotid, that is your salivary gland. Coming to gallbladder, it is highly folded mucosa with simple columnar epithelium, but there is no submucosa and no muscularis mucosae. This is the key important point. Now coming to reproductive system, for testes you have to know the seminiferous tubules is lined by spermatogenic cells, that is your primary and secondary spermatocytes, and your Sertoli cells. Interstitial cells, that is Leydig cells in clusters between the tubules, and the basement membrane myoid cells are on the tubule. For epididymis, it is pseudo-stratified columnar epithelium with long stereocilia. That is a key feature, and tubules are filled with sperm in the lumen. Smooth muscle coat around the tubules. Coming to vas difference, it is a very thick 3-layer smooth muscle wall, inner and outer longitudinal, middle circular. and a small star-shaped lumen is present and lined by pseudo-stratified epithelium with stereocilia. Both the epididymis and vas deferens is lined by pseudo-stratified epithelium with stereocilia. Coming to prostate, the glands of irregular size, shape with papillary foldings, Carpora amalasia, which are pink concretions in lumen. It is a classic identification point. And fibromuscular stroma between the glands. Coming to uterus, you have endometrium, myometrium and perimetrium. These are the layers of uterus. Endometrium, it is simple columnar epithelium with uterine glands, and you have thick myometrium, which is of smooth muscle, and layered thickness varies with menstrual cycle phase. Coming to fallopian tube, highly folded branching mucosal folds or key feature. Simple columnar epithelium with ciliated and non-ciliated cell, which is called secretory cell, that is also called PEG cells. Lining epithelium is simple columnar with cilia and few non-ciliated cells, that is called PEG cells. Thin muscularis compared to uterus. Coming to ovary, you have outer cortex and inner medulla. Outer cortex with follicles at various stages, that you have to know what is primordial, primary, secondary, mature or Graafian follicle. And inner medulla consists of vessels. You also have to know what is corpus luteum and albicans. Coming to placenta, chorionic villi with syncytotrophoblast, outer syncytotrophoblast and inner cytotrophoblast. Fetal capillaries are inside the villi. Maternal blood is an intervillous space which surrounds the villi. Coming to umbilical cord, which is very easy slide, you have two umbilical vein which has thick wall and small lumen, and one umbilical vein which is thin wall and you have large lumen. That is two arteries and one vein is the key identification point. Wharton's jelly surrounds the vessel. Wharton's jelly is a mucoid connective tissue. That is most commonly asked question. And amniotic epithelium covers the surface. Now coming for urinary system, you have kidney. The identification points are you have outer cortex and inner medulla. Renal corpuscles are formed by glomerulus and Bowman's capsule. Both Bowman's capsule and glomerulus combine to form renal capsule. So cortex has renal corpuscles and convoluted tubule. Medulla has straight tubules, loop of Henle, collecting ducts and pyramids. This is one of the question. What is located in cortex and medulla, and how you differentiate from proximal convoluted tubule and distal convoluted tubule. Proximal convoluted tubule has brush borders and narrow lumen and it is eosinophilic, whereas distal convoluted tubule have no brush border and larger lumen. For ureter, you have transitional epithelium, which is your urothelium, and thick muscularis, muscle layer, inner longitudinal, outer circular, which is opposite in VIT, and you have star-shaped lumen. For urinary bladder, you have thick transitional epithelium, 5 to 6 layers, and you have umbrella cells on the surface. You have thick muscularis layer, that is your detrusor, 3 ill-defined layers, and you have folded mucosa when empty. Urinary bladder is empty. Coming to trachea, that is your respiratory system. Trachea, it is she-shaped hyaline cartilaginous ring is the key identification feature, and it is lined by pseudo-stratified ciliated columnar epithelium with goblet cells. You also have to know other respiratory cells, and trachealis muscle is on the posterior side. For lung, you have to know pneumocytes, type 1, type 2 pneumocytes, and alveoli is thin-walled air spaces, honeycomb pattern. You have to know the difference between bronchi and bronchioles. Bronchi has cartilage, whereas bronchioles doesn't have any cartilage or glands. And you have type 1, type 2 pneumocytes. Type 2 has surfactant cuboidal cells. That is important. Coming to endocrine glands, first is pituitary. You have anterior lobe, posterior lobe. So anterior lobe is called pars distalis, whereas posterior lobe is called pars nervosa. Anterior lobe have acidophils, basophils, chromophores, and posterior lobe have non-myelinated axons, pituitarides, and herring bodies. Pars intermediate between two, and it is colloid filled cyst. Coming to thyroid gland, follicles filled with pink colloid, that is a key identification feature. Follicular cells lining each follicle is cuboidal. You have to know the different types at different stages, which is columnar and cuboidal. When it is active, it is more columnar. And parafollicular C cells between the follicles, and it is paler staining. Coming to adrenal gland, you have to know the cortex and medulla. Cortex, you have three zones. One is zona glomerulosa, zona fasciculata, and zona reticularis. Zona glomerulosa is outer arched clusters, whereas zona fasciculata is middle long cords. It's also called spongiocytes, and zona reticularis is inner branching cords. When coming to these all three zones of cortex, coming to medulla, you have chromaffin cells, which is polygonal, stained dark with chromaffin cells. That is very important. And coming to salivary glands, you have serous, mucous, and mixed. Coming to serous, which is the example is parotid. It is purely serous. You have round, dark staining and basophilic, no mucus acini, and you have the nucleus is in the center, which is round, and you have prominent striated ducts, whereas in pancreas you don't have striated ducts. For mucus, which is sublingual is an example, you have predominantly mucus acini, which is pale, foamy, and flattened basal nucleus, and you also have serous demulons, which is or cap, serous cap, and poorly well developed striated ducts. Coming to mixed salivary gland, submandibular gland is an example, mostly serous and also with numerous mucus acini. Serous demulon was also seen, and it has striated and intercalated disc. Coming to nervous system, cerebellum, we have three layers. The mnemonic is my personal garden, which is molecular, Purkinje layer, and granular layer. First is molecular, M, Purkinje layer, and granular layer. Outer molecular have pale and few cells. Purkinje cells or large flask-shaped neurons in single row, which is the key identification feature in cerebellum. And you have arbor vitae, which is branching white matter, and gray matter is outside, white matter is inside, which is opposite to cerebrum. Coming to cerebrum, you have outer gray matter. The cortex has 6 layers, and pyramidal cells you have, and the outer gray matter surrounding the inner white matter, which is very important, and you have pia matter on the surface. And neurons are largest in 5th layer, which is called pyramidal layer. Coming to spinal cord, you have central gray matter in H or butterfly shape, white matter outside, and central canal is at the center. You have anterior horn and posterior horn. Anterior horn, you have large multipolar motor neurons, whereas posterior you have small neurons. Coming to tongue, you have papilla on the dorsal surface. Papilla are filiform, fungiform, circumvallate, depending on the region. You have skeletal muscle bundles in cross sections. Circumvallate papilla have taste buds on the lateral wall, which is an important feature, and you also have von Ebner's serous gland, that is in tongue. Von Ebner's serous gland is present in tongue. Coming to retina, you have 10 layers. Coming to retina, you have 10 layers, but focus on pigment epithelium, which is outermost. You have photoreceptor cells, which is rods and cones. You have outer inner nuclear layer, outer inner plexiform layer, ganglion cell layer is an innermost. And ganglion cells give rise to optic nerve fibers. This is very important. And coming to cornea, you have 5 layers. They are stratified squamous non-keratinized epithelium, Bowman's membrane, stroma. Stroma has regular collagen lamella, which is avascular. That is a key feature. Basement membrane and endothelium. I'm just telling the layers from top to down. First is your epithelium, which is stratified squamous non-keratinized. Then is Bowman's membrane, then stroma, then Desmond's membrane, then endothelium. And avascularity is a hallmark identification point. And stroma has regularly arranged collagen fibers, which is responsible for the transparency. This is your important viva question.